Giving oxygen. This video shows how to determine whether a patient needs oxygen and how to give it. A patient who needs oxygen will often have fast breathing, anxiety, and sweating. They may have nasal flaring. Look for accessory muscle use in their neck or between the ribs. Pursed lip breathing is common in patients with COPD. Wear gloves and a face mask. If available, use a pulse oximeter to measure the level of oxygen in the patient's blood. A patient needs oxygen if their oxygen level is less than 92%. A patient with COPD needs oxygen if their level is less than 88%. The nasal cannula. If the signs of breathing difficulty are not severe, start by giving oxygen through a nasal cannula. Position the cannula in each nostril, then loop the tubing over the ears so that the tubing is on the front side of the patient's body. Start oxygen at a low flow rate, 1 to 2 liters per minute. Monitor the patient for improvement in her breathing and the oxygen level. The goal is an oxygen level above 92%. If still low, increase the oxygen flow rate up to 5 liters per minute. The face mask. If after 5 minutes with a nasal cannula, breathing has not improved, or the oxygen level is still less than 92%, change to a simple face mask. Place the face mask on the face, then pull the strap over the head. Adjust the elastic and pinch the nose of the mask to reduce air leaks. Increase oxygen from 6 to 10 liters per minute. If the patient needs more than a nasal cannula, you will either need wall oxygen or an oxygen cylinder. An oxygen concentrator typically cannot deliver oxygen higher than 5 liters per minute. The non-rebreather mask. After 5 minutes on the face mask, if her breathing has not improved or the oxygen level is still less than 92%, use a non-rebreather mask. Discuss with the patient what you need to do and why. To prepare the non-rebreather mask, attach the oxygen and put one finger over the valve at the top of the reservoir bag to inflate the bag. Always inflate the bag and connect it to oxygen before placing the mask on the patient. Increase the oxygen flow to 10 to 15 liters per minute. The mask should cover the bridge of the nose and extend below the lower lip, but not past the chin. The non-rebreather mask provides close to 100% oxygen if the reservoir bag is full. With each step, check that the oxygen is flowing, the equipment is working correctly, and if you are using a cylinder, that the pressure gauge shows there is still enough oxygen in the tank. For patients who present in extreme respiratory distress with a very low oxygen level, start directly with the non-rebreather mask. Remember, escalate oxygen therapy from nasal cannula to simple face mask to rebreather mask according to the patient's response and oxygen needs.